Okay ค่ะ Good morning, lovely people. Today our group will be presenting about a case of diarrhea in goats. And these are the outline of our presentation. And these are our group members. First, let's start with the signal meaning. At the day of examination, there were 2 sick goats in the herd, which contained around 20 to 30 goats in total. The first goat being a 2-month-old female bull, which will be referred to as 1, and the second sick goat being a 2-year-old adult female bull, which will be referred to as 2. The chief complaints from the farm owner were loss of appetite, diarrhea, and sudden death. On the day of visits, which were 10th of October, we did some additional history taking. Onset of diarrhea and anorexia began around 2 months ago. The herd saw its first mortality around a month after the onset. There were 4 goats There were 4 deaths in a span of 1 month, and the intervention was made by administration F subcutaneously, 1 cc for young kids and 2 cc for adults. However, diarrhea, anorexia, and death still persist until the day of visit. As for the management, the routine feeding regimen of this farm includes gratin and on pasture daily. No history of vaccination program and no quarantine for newly introduced goats. As for the period treatment, this farm has given Neosal K and Ivomec F to all of the sick goats, but the clinical side didn't improve.
Next is the physical examination. For the goat number 1, the heart rate is 162 beats per minute. Respiratory rate is 30 beats per minute, with a lumen contraction rate of 4 times in 2 minutes. The temperature is elevated at 39.7 degrees Celsius, and both Hansa and Langsa are normal. The body condition score is 1 out of 5, and the mucous membranes are white. For the goat number 2, the heart rate is 130 beats per minute. Respiratory rate is 10 beats per minute. The lumen contraction rate is the same, and the temperature is 39.4 degrees Celsius. Both Hansa and Langsa are also normal, with the body condition score of 2.5 out of 5, and the mucous membrane are white. Moving to the next examination, we observe white mucous membranes in both goats, indicating a high Pharmachat score of 5, which suggests severe anemia. Additionally, we observe watery stool, a sign of diarrhea. And we can list the specific problem. This is diarrhea and pale mucous membrane with a Pharmachat score of 5, and non-specific problem is anorexia. And in the initial assessment, we categorize diarrhea into infection and non-infection cause. The infection causes include bacteria, virus, protozoa, and parasite, and non-infection causes include antibiotics and new replacers. However, we can rule out non-infection cause from the history taking, and we can categorize the infection cause of diarrhea. The detail as follows. Based on all the information collected, we decided to test as follows: complete blood count, serum biochemistry, electrolytes, fecal examination, and OOC count. For goat number 1, result of complete blood count were leukocytosis and neutrophilia, severe anemia, low MCFC, thrombocytosis, and hypoproteinemia. Platelet smear were increased, found anisocytosis and microcyte. Both phagocytosis and acanthocyte were true positive, and not found but parasite. Fibrinogen value was 0.2 gram per deciliter. Result of Serum biochemistry were hypoalbuminemia, hypoproteinemia, and hyperglycemia. And for goal number 2, result of complete blood count were leukocytosis, neutrophilia, severe anemia, thrombocytosis, and hypoproteinemia. Platelet smear were increased, anisocytosis and microcytes were found few number, and phagocytosis and acanthosis was both one positive and not found by parasite. Fibrinogen out is also 0.2 gram per deciliter. And to say for goal number 2, serum biochemistry value found hypoalbuminemia and hypoproteinemia. So interpretations are as follows. Both of them are severe anemia, marked thrombocytosis, leukocytosis, neutrophilia, hypoproteinemia, hypoalbuminemia, but goal number 1 also was hyperglycemia. Laboratory results from fecal sedimentation and fecal flotation. Goal number 2 found storm type 3,908 per gram, average species 500 oocysts per gram, and another goal that no clinical sign found storm type 1,308 per gram, average species 12,300 oocysts per gram. So we can rule in protozoa and parasite that are average species and Stopzarida. Tentative diagnosis is coccidiosis and parasitic infection-induced diarrhea, and the prognosis was poor due to the ghost being severely anemic. Then we treat the herd with albendazole dose 5 mg per kilo per oral and toltazolil 20 mg per kilogram per oral once.
As for the treatment plan, the herd will be followed in 2 to 3 weeks after the first antihelmintic administration to monitor for the clinical sign improvement and perform additional fecal collection to determine the fecal egg count. If the clinical sign and the overall health of the previously 6 goat is not improved and the fecal egg count is below 500 strong joint eggs per gram feces, the antihelmintic can be discontinued. But if clinical signs did not show improvement and the fecal egg count is above 500 strong joint eggs per gram feces, another class of antihelmintic should be considered. And as for the disease progression on a day after the day of visit, one was dead, and then the herd was treated with antihelmintic, and as per the last follow-up phone call with the owner, 2 was still alive and has started to take in feed. And now to the last section of our presentation, the discussion. Nothing was perfect since we only performed diagnostic method and failed to provide treatment to the sick goat on the day of the visit. Since both goats score PharmaShop 5, immediate treatment is indicated to ensure the recovery of the animals. The necessary therapeutic intervention includes antihelmintic administration, blood transfusion, and iron supplementation. As for the antihelmintic that can be given are the parenteral palmoate, albendazole, fenbendazole, ivermectin, and mosivectin. And the iron supplementation is essential for the hemoglobin synthesis and the blood. Iron can be supplemented in the form of ferrous sulfate if given per oral or in the form of iron dextran if given parenterally. And based on the PharmaShop score and the 5 to 6% of hematocrit from the lab result, blood transfusion should be prioritized to ensure the survivability of the animals. Generally, blood transfusion should be done in goat with PCV lower than 10%, and cross-matching in small ruminant is rarely performed due to the expense and many blood groups that were present. Also, reactions are quite rare in small ruminants during the first transfusion. As for the donor of the blood, the donor could be any healthy goat in the herd with hematocrit more than 30%. The maximum blood volume that can be collected from a donor is 10 to 15 milliliters per kilogram body weight, or 20% of the blood volume per month. As for transfusing donor blood into recipient, infusion should start at a slower drip for the first 15 minutes. If no reaction occurs, the rest of the volume may be transfused at a rapid drip. If animals show signs of reactions such as tachypnea and fever, epinephrine is a drug of choice for the transfusion reaction. As for the monitoring, close monitoring on pre, during, and post transfusion is necessary, The important parameters that we should monitor are body temperature, heart rate, respiratory rate, and the cosmetic color. The signs of improvement in patient receiving blood transfusion are bright, alert, and responsive, start to stand and walk, able to urinate, defecate, and start eating and drinking water in a day after blood transfusion.
For management, there are some points that should be suggested to the farmer. First is separate the sick goats from the herd to prevent spreading of the disease or infection. Second, the anthelmintic plan, both drug and deworming method shouldn't be repeated for many times. The plan should be switched once in a while to reduce the incidence of drug resistance. The goat should be weighed and give the exact dose of each. And also the deworming schedule should be planned. Deworm only when it's necessary, which means the animal with high Pharmacia score or has pale pink to white membrane needs to be dewormed. The pasture which was already used should be raised and rotate the goats to other pasture. Release the goats into pasture at noon can help reducing a chance of ingesting infective stage larvae and reduce risk of parasitic infection. Fourth, force feed water to the sick goats to correct hydration status and avoid dehydration. The goat shed should be at least 2.5 meters high from the ground. And the last thing that should be educated to the farmer is after giving the goats the treatment, the goat should still be quarantined for 3 weeks. This farm has been giving the goat Ivermectin F for deworming, but why some of the goats still infected parasites? It brought up 3 main reasons for why ivermectin didn't work in this herd. First is inappropriate dosing, which is less likely because this farm has gave overdose. Second is route of administration. The farmer said he gave ivermectin F by subcutaneous route, but after reviewing, oral preparation are generally preferred over injectable, as the antihelmintic is allowed to directly act on the parasites in the GI tract. And the last reason is this farm may be facing drug-resistant parasites. Then how can parasite be resistant to ivermectin or macrocyclic lactones? There are 2 mechanisms of action of macrocyclic lactones, which are GABA agonist and glutamate-gated chloride channel binding. Both block transmission of neurosignals of the parasite, risk to paralyze and expel out, or even starve the helminth. Some research have found that there are different P-glycoprotein between drug-resistant helminths and non-drug-resistant helminths, which is a group of multi-drug resistant transporters. And some researchers detected P-glycoprotein by PCR, and no difference was found. So they just believe that the drug-resistant mechanism is related to P-glycoprotein, but it is still unclear. As the best method for detecting anthelmintic drug resistance was still unknown, is still unknown. So for now, the gold standard for determining anthelmintic resistance is fecal egg count reduction test. Compare fecal egg count before and after given ivermectin F for 10 to 14 days. If the parasitic egg is found reducing more than 90%, that means the drug is effective. If ivermectin, which is a drug in macrocyclic lactone class, isn't effective, then we should change to use the drug in another class such as benzimidazole, imidazole, triazole, or tetrahydropyrimidine. And levomethazole is recommended. Parasitic infection is usually found in goats because of their nature. These are 3 parasites commonly co-infecting Thai goats, which are Haemococcus contortus, Osteotegia species, Trichistrongyla species, and it is called hot disease. This is our reference. Thank for your attention, and thank for our professor and staff for guiding and supporting us.